Examine for crowning. If you see crowning, confirm whether presenting part is a head by gentle palpation. Support the perineum gently with a towel. Wait for the head to emerge. Once the head emerges, use your fingers gently to examine for a nuchal cord. If a nuchal cord is present, you may be able to slip the cord over the head during delivery. Wait for the head to restitute, which is indicated by head turning. With next push, apply gentle downward pressure to deliver anterior shoulder first and then posterior shoulder. Once baby is out, gently wipe away secretions. If baby looks well, baby can be put on mother's chest to keep warm. On the other hand, if meconium is present, which can be noted by green or brown discoloration of the amniotic fluid, use the bulb suction to suction mouth first and then each nostril after.